What clogged ears might be telling you. Experiencing a sudden, clogged ear sensation can be unsettling, but when it occurs after taking a diuretic like bumetanide, it's a signal from your body that demands attention. This symptom, though not widely discussed, offers a critical window into the complex interplay between medication, electrolytes, and the delicate balance of the inner ear. Drawing from patient experiences and supported by clinical insights, this article explores the causes, potential risks, and actionable steps to manage this side effect safely. The clue: why Gatorade worked, but water didn't. A patient's observation provides a powerful diagnostic clue. Their clogged ear sensation persisted after drinking plain water but resolved after consuming a sports drink rich in electrolytes. However, it is crucial to note that this is not a recommendation for self-treatment. For patients with heart failure, kidney disease, or high blood pressure, high-sodium drinks can be dangerous and worsen their condition. This observation simply points to the underlying issue of an electrolyte imbalance, which should be addressed by a medical professional. This distinction is key to understanding the root cause and guiding safe responses. The difference between temporary disruption and ototoxicity. The clogged ear sensation is often a reversible form of ototoxicity, but it's important to distinguish between a temporary symptom and a more serious condition. While a feeling of fullness or pressure is a real-time signal of a rapid electrolyte shift, you must seek immediate medical care if your symptoms are accompanied by sudden or rapid hearing loss, severe dizziness or vertigo, persistent tinnitus, ringing in the ears, that is new or worsening, irregular heartbeat or chest pain. Temporary ototoxicity refers to a short-lived inner ear disturbance that resolves when the underlying cause, like an electrolyte imbalance, is corrected. Permanent ototoxicity, on the other hand, involves lasting damage to the delicate hair cells of the inner ear. Your clogged ear sensation is a crucial warning sign that you may be at risk for this more serious condition if the electrolyte imbalance is not addressed. Actionable steps for patients when a doctor is not available. Immediate medical consultation is ideal, but if unavailable, here are steps to manage the situation safely. Do not panic, the sensation is often a temporary result of an electrolyte shift. Avoid high-sodium solutions, steer clear of sports drinks, broths, or processed foods high in sodium. Do not self-medicate with potassium, avoid potassium supplements or foods like bananas, oranges, or spinach without doctor approval. The risks of hyperkalemia are severe. Consider a controlled observation. As a temporary measure to gather information for your doctor, you can perform a controlled observation. For example, if you are experiencing ear clogging, you could consume a small portion of a magnesium-rich food that is already part of your healthy diet, such as a few almonds or a spoonful of pumpkin seeds, and note if the symptom improves. The purpose is not to find a long-term solution but to identify potential patterns to discuss with your doctor. Track symptoms and intake. Use a notebook or app to log symptoms, fluid intake/output, and daily weight. Sudden weight changes, e.g., greater than 2 pounds per day, may indicate fluid or electrolyte issues. Communicate with your doctor, as soon as possible, share detailed notes, including symptoms, medications, and observations about water versus electrolyte drinks. Bumetanide and the multi-electrolyte imbalance. Bumetanide, a potent loop diuretic, increases water and electrolyte excretion to manage conditions like heart failure, high blood pressure, or kidney disease. Its effects disrupt multiple electrolytes, any of which may contribute to the clogged ear sensation. Below is a detailed breakdown of the key players, with typical blood level ranges provided for context. Consult your doctor for personalized interpretation. Chloride, Cl-, a key contributor. Bumetanide blocks the sodium-potassium chloride cotransporter in the kidneys, leading to significant chloride loss. Normal range, 98 to 106 milliequivalent/L. Low chloride can disrupt fluid and pressure balance in the inner ear, crucial for hearing and balance, manifesting as a feeling of fullness or pressure. Magnesium, Mg2 plus. The often overlooked culprit bumetanide increases magnesium excretion, normal range, 1.7 to 2.2 mg/dl. Magnesium is vital for the tiny hair cells in the inner ear that detect sound and maintain balance. Deficiency can lead to hearing issues, muscle weakness, or balance problems. Potassium, K+, and sodium, Na+. The usual suspects. Bumetanide causes loss of potassium, normal range, 3.5 to 5.0 milliequivalent/L, and sodium, normal range, 135 to 145 milliequivalent/L. These imbalances, alone or combined, can trigger ototoxicity, a form of inner ear toxicity that may present as clogged ears, tinnitus, or dizziness. How the inner ear works. To understand why an electrolyte imbalance can cause a clogged ear sensation, it helps to know a little about how your inner ear functions. The inner ear is a delicate, fluid-filled system that is crucial for both hearing and balance. Think of your inner ear as a tiny, fluid-filled instrument with thousands of microscopic hair cells. When sound waves enter your ear, they cause the fluid to move, which in turn bends these delicate hair cells. This bending sends electrical signals to your brain, which it interprets as sound. The fluid in the inner ear, called endolymph, is unique because it has a very specific and delicate electrolyte composition, particularly a high concentration of potassium. Diuretics like bumetanide can rapidly change the balance of electrolytes in your body, which can disrupt the delicate balance of the endolymph. When this fluid balance is thrown off, the hair cells can't function correctly, leading to the sensation of pressure, fullness, or clogged ears. The dangers of long-term imbalance. While a single episode of ear clogging may be short-lived, for patients taking bumetanide daily over years, the repeated electrolyte shifts can have serious long-term consequences. This daily disruption, if left unaddressed, can lead to a sustained deficiency of key electrolytes. This is especially concerning for heart failure patients, who are at risk for conditions like systemic muscle loss, cachexia. Chronic hypokalemia and hypomagnesemia can contribute to muscle weakness, cramps, and fatigue, which may worsen the overall debilitation associated with heart failure. Thus, the ear clogging sensation should not be dismissed as a mere nuisance. It's a critical signal that the daily imbalance needs to be taken seriously and rectified to prevent more severe, cumulative problems. Could it be something else? While electrolyte imbalance is a likely cause, other conditions can mimic a clogged ear sensation, even in diuretic users. Earwax buildup. Impacted earwax can cause a feeling of fullness, unrelated to medication. Eustachian tube dysfunction, allergies, colds, or sinus issues can block the tube connecting the ear to the throat. Meniere's disease or other ear conditions, pre-existing inner ear disorders may exacerbate symptoms. Medication interactions, drugs like ACE inhibitors, NSAIDs, or aminoglycoside antibiotics, when combined with bumetanide, can increase ototoxicity risk. If the sensation persists or is accompanied by hearing loss, tinnitus, vertigo, or severe headache, it may not be solely electrolyte related, warranting prompt medical evaluation. Crucial safety warning: the dangers of high potassium. While electrolyte deficiencies cause symptoms, excess potassium, hyperkalemia, can be life-threatening, especially for those on potassium-sparing diuretics like spironolactone. Hyperkalemia, K+ greater than 5.0 milliequivalent/L, can cause fatal heart rhythm abnormalities. Avoid potassium supplements or high potassium foods, e.g., bananas, oranges, without medical guidance. Similarly, excessive sodium intake can worsen fluid retention in heart failure or kidney disease, counteracting diuretic benefits. Hydration and medication timing. The timing of your hydration and medication can significantly impact how your body handles the effects of bumetanide. Since this medication acts quickly, strategic timing can help you preemptively manage rapid electrolyte shifts and minimize symptoms like the clogged ear sensation. Preemptive hydration. To help your body prepare for the diuretic's effects, try to consume most of your daily fluids and electrolytes before you take your dose. This ensures your body has a healthy reserve, which can buffer the rapid electrolyte excretion caused by the medication. Take with food. Unless your doctor advises otherwise, taking bumetanide with a meal can be beneficial. Food can slow the medication's absorption, making the electrolyte shift less abrupt and intense. Space out high-potassium foods. For patients whose doctors have confirmed it's safe to consume potassium-rich foods, it's best to space them out throughout the day rather than eating them all at once. This helps maintain a more stable level of potassium and prevents a sudden drop after the diuretic takes effect. Who's at higher risk? Certain groups may be more susceptible to diuretic-induced ototoxicity. Elderly patients, age-related declines in kidney function or inner ear health increase sensitivity to electrolyte shifts. Those with pre-existing ear conditions like Meniere's disease or prior hearing loss heighten vulnerability. Patients on multiple medications, combining bumetanide with drugs like lisinopril, ACE inhibitor, or ibuprofen, NSAID, can amplify electrolyte imbalances or ototoxicity risks. How symptoms may differ by condition. While the underlying cause is an electrolyte imbalance, the specific way you experience symptoms can vary depending on your primary health condition. For patients with heart failure, the clogged ear sensation might be an early warning sign that the diuretic is working a little too aggressively, potentially leading to dehydration and a rapid loss of fluid. This could happen alongside other signs of fluid imbalance, such as sudden changes in weight or lightheadedness when standing up. For patients with kidney disease, the symptom might be a more direct reflection of the kidney's struggle to regulate specific electrolytes. Because the kidneys are already impaired, even a small diuretic-induced shift can have a more pronounced effect on the body's overall electrolyte balance, leading to the ear sensation. In both cases, this symptom is a key indicator that your doctor needs to assess your medication dosage and electrolyte levels. The role of hearing and balance specialists. While your primary care doctor or cardiologist will manage your diuretic therapy, symptoms affecting your hearing and balance warrant a specialist's evaluation. It's crucial to seek a referral if your symptoms are persistent or severe. Audiologist. An audiologist is a healthcare professional who specializes in diagnosing and treating hearing and balance disorders. They can perform an audiogram, a non-invasive hearing test, to objectively measure any hearing loss. This is the most reliable way to determine if there has been any permanent damage to the delicate hair cells in your inner ear. ENT. Otolaryngologist. An ENT is a medical doctor who specializes in conditions of the ear, nose, and throat. They can perform a thorough physical examination to rule out other possible causes of your symptoms, such as earwax buildup, eustachian tube dysfunction, or other pre-existing inner ear conditions like Meniere's disease. Working with these specialists ensures a comprehensive approach to your care and provides a more accurate way to monitor for any long-term effects of your medication. A note on electrolyte-rich foods. For informational purposes only. Do not make dietary changes or add supplements without first consulting your doctor. Magnesium, Mg2+. Key functions. Essential for nerve and muscle function, especially the tiny hair cells in the inner ear. Some food sources, to discuss with your doctor: pumpkin seeds, almonds, spinach, black beans, avocados. Potassium, K+. Key functions, crucial for heart function, muscle contractions, and maintaining fluid balance. Some food sources, to discuss with your doctor: bananas, oranges, potatoes, sweet potatoes, spinach, tomatoes. Sodium, Na+. Key functions: helps regulate fluid balance, blood pressure, and nerve signals. Some food sources, to discuss with your doctor: table salt, processed foods, canned soups, sports drinks. Chloride, Cl-. Key functions: works with sodium to maintain fluid balance and blood pressure. Some food sources, to discuss with your doctor: table salt, seaweed, lettuce, tomatoes, celery. The role of your doctor. Your doctor will likely order an electrolyte panel to identify specific imbalances. It is crucial to remember that because bumetanide's effects are short-lived, a standard blood test may not always capture a temporary imbalance. This makes your detailed symptom notes invaluable for your doctor. Timing blood tests: if your symptoms are recurrent, your doctor may recommend drawing labs within a few hours of your diuretic dose to better capture these transient electrolyte shifts. Based on your information and test results, they may adjust your diuretic dose or switch medications. Prescribe targeted supplements, e.g., magnesium oxide for low magnesium. Recommend dietary changes or monitoring frequency. Schedule follow-up tests to prevent recurrence. Expect regular monitoring, especially if you're elderly or on multiple medications. Your doctor may also assess for earwax or other ear conditions via otoscopy. Summary of key takeaways. The clogged ear sensation is a crucial signal of a rapid electrolyte imbalance caused by a diuretic. Never attempt to self-medicate with high sodium or high potassium foods or supplements without your doctor's guidance. Seek immediate medical care if you experience severe symptoms like sudden hearing loss, vertigo, or chest pain. Keep detailed notes on your symptoms and share them with your doctor to help them determine the best course of action. This symptom, while unsettling, is often manageable with proper medical guidance and dose adjustment.